Hello, everybody. My name is Meg Fitzpatrick, and I'm the psychology manager here at Prosper Health. We just wanted to do a deeper dive into some of these DSM criteria, just a little refresher for those of you that know it well, and a little bit of a deeper dive for people that might be sort of seeing these through the lens of adults more recently for the first time. So, with regards to Criterion A, in the DSM, the social communication aspect of this is Criterion A. This is characterized by persistent deficits in social communication and social interaction across multiple contexts, as manifested by all of the following, currently or by history. So, all three of these criteria that we're going to discuss need to be met to make a diagnosis. The first is social emotional reciprocity. So, deficits in social emotional reciprocity, ranging, for example, from abnormal social approach and failure of normal back and forth conversation to reduced sharing of interests, emotions, or affect to failure to initiate or respond to social interactions. You'll see that the text on these slides is quite wordy. And the reason for that is I wanted everyone to have access to all of this information without having to watch this video over and over. So you'll see as we go that there's quite a lot of words on these, and I will just be reading a lot of them. But that is why, as this is designed to be an ongoing resource for you. There's some things to keep in mind with social emotional reciprocity. These clients may have learned familiar interactions, but they're thrown off with novelty interactions or unexpected things. Masking and camouflaging is very important. What have they learned about the back and forth? We don't want to consider that someone may not be autistic because they've learned skills. That's an important thing to find out. They may be conversational or chatty in the right context, like with familiar people. They might have learned where they can be their most true selves and feel very comfortable in those settings. These difficulties may be hard to spot when talking about interests and familiar topics, so asking them what it's like for them at things like work Christmas parties or situations where they're outside of their typical contexts. They may adhere to all social rules, like saying thank you to everyone each time they have an interaction with them, no matter if it's necessary or not. Things that stand out as maybe overly polite or things that you might say, "Oh, that feels uncommon to hear in those contexts." Do they feel comfortable offering comfort to others if they even do it? How does it feel for them to be emotionally vulnerable in that way? And then, secondarily, do others feel that their comfort is actually helpful? When you speak to their partners, does it show up that they think that they're being very helpful, but really what they're doing is unhelpful or doesn't feel comforting at all? It's also very important to differentiate this from social anxiety related discomfort in an interaction. Are they afraid of embarrassment or judgment? Or are they anxious in all social settings or just in some? A kid out of college is going to have very much more trouble in an office as an unknown setting, but may feel very comfortable in every other setting. Getting to that, why does it feel challenging is going to be really important. The nitty-gritty is that these clients may struggle with things like keeping up with the flow of conversation, understanding and following what others are talking about, and also knowing when it's their turn to speak. In terms of differentiating, please consider if the client may be showing signs of ADHD. Often, people with ADHD also struggle with these concerns because they're not focused on the conversation at hand. It's important to differentiate when they may be struggling and if they struggle to keep up, even when giving conversation or those interactions their full attention. Also, differentiating between anxiety on this is critical. Is anxiety the barrier? Are they not sure because they're so anxious, or are they not sure because there's a true deficit? Is there actually a difference in their ability, or is this driven by something else? Takeaways for this is understanding the why to why clients may struggle with this will provide a lot of insight. When things are flowing smoothly, what's the situation? Is it that they're just with people that they feel comfortable with? Is it that they're discussing a topic of interest to them? Is their challenge limited to situations in which anyone may feel uncomfortable or unsure, like unexpected meetings at work or new situations with unfamiliar people? And then again, what level does that go to? Is it anxiety provoking for everyone and everyone feels a little bit odd, or is it anxiety provoking and they try not to go? So, really finding out those kinds of nitty gritty of it. The next area is nonverbal communication. So, deficits in nonverbal communication, communicative behaviors used for social interactions, ranging, for example, from poorly integrated verbal and nonverbal communication, abnormalities in eye contact and body language, or deficits in understanding, use of gestures, to a total lack of facial expressions and nonverbal communication. Things to note, a lot of our clients probably have basic nonverbals or are able to fake it. They've learned as a child that they're supposed to make eye contact and they do it. But they have other, strategies for that, like looking at earlobes rather than eyes, or gritting their teeth and getting through looking someone in the eyes. Inquire what it's like to look at others and to be looked at. And people may be capable of figuring out others' thoughts and feelings, but it likely isn't automatic. It often takes a lot of deliberate effort to figure those things out. Sometimes we will also have clients who are incredibly empathetic and read people really well, but then may misinterpret. So they may think that someone is looking upset, but the person's in fact fine. The nitty-gritty is what kind of feedback did they get on their body language as a child? Did they receive coaching to make eye contact? Were they too close or too far away from peers? When asking questions about how others may be feeling based on their face, this may be a learned behavior. So ask about it. They may have learned to understand how others may be feeling based on their face over time, rather than feeling that it's an inherent ability. Differentiating in this one is also really important. Extreme anxiety can have people unsure of what to do with their hands and or bodies and potentially have others watch or potentially watch others to see what they're doing to make sure that they blend in and look okay. Some people mirror in attempts to not stand out, which may be the case with social phobia type behaviors. I don't want to be perceived as different. And again, that will then come back to what happened with their social emotional reciprocity kinds of questions. Is it the fear of judgment, a fear of embarrassment, or is it that they genuinely don't know what to do with their body? Social phobia can also mean people struggle with eye contacts and attempts to not be seen or perceived. And clients with trauma histories also likely do quite well understanding how others may be feeling based on their face or tone. So, making note of this if they appear to do it well but struggle in other areas may be helpful for readers of your report. If a client grew up in an incredibly volatile household, they may have unbelievable abilities reading how others may be feeling, and then also struggle with their own face or eye contact in those ways. And just mentioning, client has a trauma history might go a long way to explain that. Takeaways for this is that there's a lot of reasons someone may struggle with nonverbal communication. So, understanding when and where these things become a challenge will be helpful in determining true deficit versus a symptom of something else. And the last area is relationships. This is defined as deficits in developing, maintaining, and understanding relationships, asking what play was like, but know that, for example, difficulties adjusting to behavior to suit various contexts, to difficulties in sharing imaginative play or making friends, to absence of interest in peers are all things that could show up. Things to note, this includes play in childhood, as we have mentioned. Ask what play was like, but then know that for autistic girls, it may appear typical. Pretend play is possible, but may be highly scripted or reenacting content. If they say, "Oh, I love to play with my friends," and you get into the nitty-gritty, are they just repeating things that they've seen in movies? Or are they doing the same thing over and over? Clear signs of challenges in this may be not evident until middle school. You can have friends and be autistic. Many people with autism do have friends. So they could be interest based. So they can, they D&D friends. They can be lifelong friends. Having friends does not preclude you from a diagnosis. People with autism may have more diversity in their friend group. Their friends may be much older than them or much younger than them. They may be able to describe relationships or have learned explicit rules for how to act in them. And they may have difficulty reining it in and behaving differently in different situations, like talking to a boss like a friend. And so, again, just understanding where the challenge comes up is going to be important. The nitty-gritty of this is clients who were bullied may recall being bullied only with hindsight and report that in the moment they didn't notice. A helpful follow-up is to ask about noticing challenges with this currently, such as not noticing when someone may be using them or treating them unkindly. Do they have a history of being involved in romantic relationships that were unsafe? those kinds of questions about what their judgment's like in the moment with others. When discussing friendships in school, it's helpful to parse out kids they only saw in school versus kids they saw outside of it and who set those actions up. So, if they initiated seeing their friends outside of school, or if parents did, or if they were neighborhood kids that their parents were all friends, just understanding what those relationships looks like is helpful. If they have friends now, how often do they see each other or speak? Are they local? Are they online? Have they met in real life? All of those kinds of things. You can have a friend that you only speak to every 6 months, and it's an important data point if that's the only friend that you speak to. How do they make new friends? Do they know how to build a friendship and maintain it over time? Is it deep or is it superficial? Are they defining friends as someone that they spend time with, or are they defining it as someone that they can become vulnerable with? How much does that person share with them, and how much are they sharing back? Differentiating is really helpful in this again. Social phobia can stand in the way, and so can trauma. Building relationships with people when you have a history of being hurt by those, is important. It's, as we know and as common sense dictates, people are going to be less receptive to new relationships if every time that they have been in those relationships, they've been hurt by them. And again, just sort of understanding what that looks like for each client will go a long way. Takeaways for this is autistic people can have loving, supportive, and caring relationships. It's crucial to know how they got to that point with their friends. What other relationships, what do other relationships in their life look like, romantic or otherwise, and how do they form new friendships? Where are the challenges? Where are the deficits? How have they come up over time? And just getting a really good sense of how people feel about those relationships is also really good. We also have a Criterion B, so please make sure to go check all that out. Thanks very much.